Right now, I want you to think about your legs. Not what they look like, but what they feel like. Do they feel heavier than they used to? Does one ankle look puffier than the other by the end of the day? Have you been woken up at 2 in the morning by a cramping pain in your calf that grabs you out of a dead sleep? If any of that sounds familiar, here is what I need you to hear before we go any further. The odds are extremely high that someone, a doctor, a family member, maybe even your own inner voice, has told you that's just part of getting older. And I am here to tell you that that answer is one of the most dangerous things anyone can say to a person over 60. Every single year in the United States, up to 900,000 people develop a life-threatening blood clot inside their leg. A condition called deep vein thrombosis. Up to 100,000 of them die. Not from cancer, not from a fall, from something that started weeks earlier as a dull ache, a little swelling, a cramp that didn't quite go away. Symptoms that were dismissed, normalized, written off. I'm Dr. Nathan Cole, and in my years treating patients over 60, I have sat across from people in the emergency room who told me they had felt something off in their legs for weeks. They just didn't know what they were feeling. Today, I'm going to change that. I'm going to show you 7 specific warning signs your legs may already be sending you. Signs that most doctors never discuss during a routine appointment. And I'm going to tell you exactly what to do when you recognize them. But before the signs, I need you to understand the biology. Because once you see what's actually happening inside your veins, every warning sign will make perfect sense. Think of your vascular system as a city's road network. Your heart is the central hub.
Your arteries are the outbound lanes, carrying oxygen-rich blood out to every corner of your body, and your veins are the return roads, carrying used blood back to the heart and lungs to be refreshed. Now, the veins in your legs have the hardest job in the entire system. They have to push blood upward against gravity, from your feet all the way back to your chest. To do this, they use tiny internal valves. Imagine small one-way trapdoors built into the wall of the vein that open to let blood flow upward and snap shut to prevent gravity from pulling it back down. When you're in your 30s and 40s and you're moving regularly, these valves work beautifully. But beginning in your 50s and accelerating through your 60s and 70s, those valves weaken. They lose their snap. Blood begins to slow down in the lower leg, to pool, to stagnate. And here is the detail that most people never learn until it's too late. Slow-moving blood clots. That is not a figure of speech.
That is basic vascular physiology. When blood lingers too long in a vein, it begins to thicken, to accumulate cellular debris, to form a mass, a deep vein thrombosis. And between the ages of 70 and 79, the incidence of DVT reaches 500 cases per 100,000 people annually. That is 5 times the risk of someone just 15 years younger. Here is what makes me genuinely angry as a physician. Most of these cases are preceded by clear warning signs, signs that patients bring to their doctors and that are too often met with reassurance instead of investigation. Most doctors won't bring this up during a routine visit. Not out of negligence, out of time, out of habit, out of a system that rewards speed over depth. I've seen colleagues look at a 67-year-old with swollen ankles and say, "That's normal at your age." I understand the logic. I disagree with the outcome, because the standard advice most people over 60 have heard their entire lives, that leg heaviness and swelling are just the price of aging, may actually be working against you by keeping you from recognizing a genuine warning. So let me give you the 7 signs. Pay close attention, because some of them are obvious, and some of them will surprise you. The first warning sign is persistent heaviness in one leg, not both. This distinction is one I cannot stress enough. When both legs feel heavy after a long day on your feet, that's often fatigue and gravity doing their ordinary work. But when one leg consistently feels heavier than the other, like something dense is sitting inside it, that asymmetry is medically significant. A clot forming inside the deep vein creates local pressure and inflammation that affects only the limb it's in. If you notice one leg lagging behind the other in how it feels, If one limb seems to require more effort than the other just to move through a normal afternoon, that asymmetry is your body flagging a problem. Note which leg. That detail will matter to your doctor. The second warning sign is swelling in one ankle or calf. Again, 1. Bilateral swelling in both ankles can indicate heart or kidney issues, but unilateral swelling, particularly when it has come on gradually over days or weeks rather than appearing overnight, is a classic presentation of deep vein thrombosis. If you press your thumb gently into the swollen area and the indentation holds for a few seconds before the skin springs back, that is called pitting edema. It tells you that fluid is being pushed out of your veins into the surrounding tissue because internal pressure inside that vein has become elevated. That elevated pressure has a cause. It is worth finding. The third warning sign is localized warmth and redness along the path of a vein. This is perhaps the most frequently dismissed sign because it looks like a bruise and feels like a pulled muscle. But if a section of your calf or thigh is distinctly warmer to the touch than the surrounding skin, and there is a reddish or slightly bluish discoloration running along the visible path of a vein underneath, that is inflammation. Your immune system is responding to something abnormal inside the vessel wall. Don't wrap it and rest. Call your doctor. If that local warmth and redness is accompanied by a fever above 100 degrees Fahrenheit, do not call your doctor's office and wait for a callback. Go to the emergency room. I want to pause here, because the next warning sign is the one I've seen cause the most harm, precisely because it is so easy to explain away. The fourth warning sign is a leg pain that feels like a muscle cramp, but does not fully release. Every person over 60 has had a muscle cramp. You know how they work. They build, they peak, they hurt enormously for 30 seconds, and then they let go. What I'm describing is different. DVT-related pain in the calf presents as a persistent, deep aching. Sometimes a tightness, sometimes a tenderness when you squeeze the belly of the calf, that lingers beyond what a normal cramp does. It may ease slightly when you move and return when you rest. It may have started as what felt like a stubborn cramp and simply never fully resolved. If you have had a calf pain that you have been calling a cramp for more than 48 hours without significant improvement, I am asking you, right now, to stop calling it a cramp and to call your doctor instead. The fifth warning sign is skin discoloration around the ankle. Not from an impact, not from a rash, but a brownish, reddish, or faintly yellowish staining to the skin in the lower third of the leg, particularly near the ankle bone. In medicine, this is called hemosiderin staining, or stasis dermatitis. What it tells us is that the pressure inside the vein has been elevated long enough that red blood cells are being forced through the vessel walls into the surrounding tissue. Those cells break down, release iron, and leave a permanent mark on the skin from the inside. This is not a cosmetic finding. It is a window into what has been happening inside your circulation, likely for months, possibly longer. The sixth warning sign is nighttime leg cramps that have recently escalated. Not cramps that have been stable for years, but cramps that are new, more frequent, or more intense than your baseline. Here is why that progression matters. When blood flow through a deep vein is partially obstructed, the muscles downstream become increasingly oxygen-deprived at rest. During the day, movement compensates. Each step activates the muscular pump in the calf, pushing blood through despite the obstruction. But at night, lying still, there is no compensatory mechanism. Oxygen delivery drops, metabolic waste accumulates, and the muscle fires an involuntary contraction to force circulation. The worsening of nighttime cramping is not aging. It is a physiological signal that the underlying vascular condition is progressing. The seventh warning sign is the one that means the situation has already moved beyond the leg. And this one requires that I be absolutely direct with you. Sudden, unexplained shortness of breath, especially when it comes on quickly and is accompanied by chest pain, a racing heart, or a feeling of lightheadedness, can mean that a clot has broken free from the deep vein, entered the bloodstream, traveled to the lungs, and blocked arterial flow there. This is called a pulmonary embolism, and it kills. If you have experienced any of the first 6 signs in recent weeks, and you now develop sudden shortness of breath that has no obvious explanation, do not assume it's anxiety. Do not lie down and rest. Call 911. The difference between a treatable pulmonary embolism and a fatal one is frequently measured in minutes. Now I want to shift entirely, because what I've just given you is a map of what can go wrong, and that map is only useful if it leads you somewhere. The science on what you can do to protect your circulation after 60 is not vague or complicated. It is specific, it is actionable, and it starts today. The single most powerful thing you can do for your venous health requires no prescription, no equipment, and no gym. Move your calf muscles. Every time the calf contracts, it physically compresses the deep veins in the leg and drives blood back toward the heart. That is why cardiologists call the calf the second heart. 30 minutes of walking per day remains the gold standard. But it doesn't have to happen all at once. 10 minutes after each meal is as effective as a single 30-minute session. And if walking is difficult right now, sitting in a chair and pumping your feet up and down, drawing slow circles with your ankles, rising onto your toes and lowering, these activate the same mechanism. I tell my patients who sit for long periods, set a timer for every hour and do 2 minutes of ankle pumps before it goes off. It is not glamorous medicine. It is what the evidence supports. The second tool is dietary, and this is the area where mainstream medicine is still genuinely catching up to what the research already shows. Extra virgin olive oil, not vegetable oil, not canola, is rich in polyphenols and vitamin E, both of which have demonstrated effects in reducing platelet aggregation. That is the process by which platelets clump together inside a vessel to form a clot. A tablespoon over your salad, a drizzle over cooked vegetables. That is food acting as preventive medicine. Fatty fish, salmon, sardine, mackerel, 2 servings per week. Provide omega-3 fatty acids that reduce the inflammatory signaling that makes clot formation more likely. Sunflower seeds and almonds deliver vitamin E in food form, which is the safest and most bioavailable way to get it. A small handful with your morning meal. Berries, blueberries, strawberries, raspberries, contain flavonoids that strengthen capillary walls and reduce vascular inflammation. And nitric oxide-rich vegetables, beets, arugula, spinach, dark leafy greens, help the smooth muscle in your vessel walls relax, widening the vessels and improving flow. I've watched patients make these changes and report within weeks that their legs feel genuinely different. Not because they imagined it, because the biology responded. The third tool surprises people, but it shouldn't. Water. Blood is primarily water. When you're chronically mildly dehydrated, which the majority of people over 60 are, because the thirst mechanism becomes less sensitive with age, your blood becomes thicker, more viscous, and slower moving. Slow-moving blood, as we've established, is the environment in which clots form. 8 to 10 cups spread across the day, not consumed all at once. A glass before each meal and 1 before bed is a structure that works. It is not exciting, it is protective. Here is what I want you to carry out of this conversation. Your legs are communicating with you. They have been communicating with you, probably for longer than you realize. The heaviness, the asymmetric swelling, the cramp that won't release, the skin changes near the ankle. None of that is a code that requires a medical degree to read. You have simply been told, repeatedly, that it isn't worth reading. I am telling you now, it is. If you recognize any combination of the 7 signs I've described today, make an appointment with your physician and specifically request a venous Doppler ultrasound of your lower extremities. That test is painless, non-invasive, and it will give you a definitive answer about what is happening inside those vessels. Don't wait for the 7th sign to force your hand. In the meantime, drink your water. Move your calves after every meal. Put salmon on your plate this week. These are not complicated interventions. They are the kind of decisions that, made consistently, change the biology inside your vessels over time. I have watched it happen. I watch it happen still. You are not past the window where this matters. The window is right now. If this video reached you before something more serious did, share it with someone whose legs you've heard them complain about. That neighbor who is always mentioning cramps.
The family member whose ankles are always swollen by evening. Sharing this is not just passing along a video. It is a genuine act of care. Subscribe and hit the notification bell so you don't miss what's coming next. because in the next video, I'm going to cover 5 medications that millions of seniors take every single day that are quietly making their circulation worse, including one that your doctor almost certainly has never flagged as a problem. I'm Dr. Nathan Cole. Take care of your legs. They have carried you your entire life. Let's make sure they can keep going.